Welcome and thank you for standing by. At this time, all participants are in a listen-only mode. At the end of today's presentation, we will conduct a question-and-answer session. To ask a question, please press *1. Today's conference is being recorded. If you have any objections, you may disconnect at this time. Now I would like to turn the meeting over to Ms. Peyton Purcell, and you may begin.
Great, thank you, and welcome everyone. We're excited to be able to deliver this webinar on the Dissemination and Implementation Research and Health Program announcement from NIH. I'm going to walk us through quickly a couple logistics for the call today, and then we'll turn it over to Dr. David Chambers and Dr. Joshua Rosenthal from Fogarty. So as the operator mentioned, questions are encouraged, and there's two ways to submit your questions. You can either press *1, as he indicated, to ask your question live on the phone during the Q&A session, or you can also type your question in the Q&A tab at the top of your screen and hit Ask to submit your question that way. And we'll be going through some brief slides and then hopefully opening it up for some good discussion and Q&A for the remainder of the call. And with that, I'll turn it over to Dr. Chambers.
Thanks, Peyton. So I'm David Chambers. I'm Associate Director of Dissemination and Implementation Research at the National Institute of Mental Health, and I've been one of the people who's been coordinating across the National Institutes of Health some of our activities around dissemination and implementation research. We, first of all, want to thank you for taking the time to join us from all over the world. We're grateful for those of you who got up quite early. We're grateful for those of you who stayed late. And we're hopeful that you see that this opportunity to really try and advance the knowledge base of how we get effective interventions to reach people who can benefit as one that's exciting. We are on this call because we at NIH are very interested in seeing how we can advance global dissemination and implementation research, and so thank you for joining us. And we will be making a relatively brief run through these slides, but we do want to have as much time as possible for questions. So as Peyton said, there's a couple of different ways to answer those, but we really see that this time is as much for you as possible. It's also the starting of a dialogue, so you can always feel free to reach out to us afterwards if you're not able to get your question answered. So I wanted to start out basically just by orienting you a little bit, for those of you who don't know as much about the National Institutes of Health, a bit about the structure. So the mission of the National Institutes of Health, which is part of the Department of Health and Human Services in the United States, is to transform discovery into health. We are a research agency that sees its mission as making sure that we develop as much of a knowledge base to ultimately inform the health of populations. And while we certainly are interested in the U.S. population, we see our broader mission as trying to understand better about improvements in human health. The National Institutes of Health are comprised of 27 different institutes and centers, which we refer to in shorthand as ICs. The ICs are organized in some way by disease area. So there's the National Cancer Institute, NIDDK is around digestive diseases, kidney as well, National Institute of Mental Health focusing more on mental illness. We have other institutes that are focusing more on biological systems, the Eye Institute, or dental and craniofacial research. We have others that focus on subpopulations, and others that are really aimed at trying to improve resources for the broad conduct of research. It ends up being a lot of different abbreviations, and we're certainly happy to point them out as we go along. All of the institutes and centers will either have intramural programs where we have research that's conducted within labs on the National Institutes of Health campus, or extramural programs where much of the money goes to funding research all over the country and all over the world. What we're talking about here is the extramural research. So this isn't about NIH staff conducting the research, but it's about supporting research around the globe. They're primarily funded through research project grants. You'll see mechanisms, R01s, R03s, and R21s, which are grants or contracts, and those are the major funding mechanisms. In terms of just to give you a broad sense of NIH's mission, we really do cut across from basic research, which is prior to getting into clinical practice, prior to even thinking about humans. So there's animal research, there's epidemiology, there's preclinical studies, there's basic health services research. Then moving over into ways in which those basic findings can translate into clinical or community applications, which we talk about as from basic research to the bedside, and then over to try and really make an impact on population health through policy and practice changes. As you can see in this diagram, which is not an NIH one, but helps to at least identify this broad continuum of research, more on the right end of the picture is dissemination and implementation research. We're really talking about how do we make the most of what's been discovered scientifically and translating that into the improved health of populations. So I wanted to give you a little bit of a history of the Dissemination and Implementation PARs because these are reissued program announcements. We started out not necessarily with a collective or a shared vision at NIH about dissemination and implementation research, but starting in 2005, 8 of our institutes and centers got together around issuing a combined set of research priorities. The program announcements typically have a lifespan of 3 to 4 years, and so in 2009 we had a second round where we were able to add an additional 4 institutes and centers. Simultaneously, we were also trying to think about other ways to grow capacity within the field. We had 5 State of the Science conferences at the NIH level, and we've also, over the last couple of years, had a training institute to try and get more investigator knowledge prior to submitting to these announcements. And so this is a week-long summer training institute that's been open the last 3 years. Just earlier this year, we were able to reissue for the 3rd time the NIH Dissemination and Implementation Program announcements, which we're talking about today. Now, the program announcements really have represented a shift from what has been considered historically more of NIH's mission, which has been in the basic science arena. While NIH has always had basic and applied work, it's only been within recent years that we've really been focusing as much specifically on that last building block of science of how we get effective interventions to benefit the most people they can. What we wanted to do right from the beginning, because we recognize that terms used in research may vary, is for these announcements we wanted to lay out working definitions for what we saw as 2 of the key terms within the announcement, dissemination and implementation. We recognize that there might be different challenges, there might also be different terms used, and we wanted to make sure that anyone who was interested in these announcements was at least understanding where we, NIH, were coming from. We define dissemination as the targeted distribution of information and intervention materials to specific audiences where we're trying to really spread or scale up and sustain the knowledge and associated interventions. We contrasted that from what we saw as a much more intensive process of implementation, where you're thinking about strategies that adopt and integrate interventions to try and change practice patterns within different settings, be that clinical or community or other settings. Now, we'll note for this audience that while we use dissemination and implementation, we understand that there are other countries who have long histories and long success of promoting similar areas. There may be terms that you're more familiar with to cover the same space: knowledge translation, knowledge transfer, knowledge exchange, research utilization, etc. We're very open, certainly, to the use of alternate terms. We just ask that people clarify what terms are they using and what are they meaning. We, for this announcement, use dissemination and implementation. While we're not going to go through line by line the associated program announcements, we wanted to just call your attention to the breadth of knowledge that we're looking to gain from it. So we've laid it out in terms of some topics, some questions that may be more related to dissemination, some more related to implementation, and some that really do cut across. For dissemination, again, as we were talking about trying to best understand knowledge transfer, or how knowledge is created, transmitted, packaged, shared, and received, there's a number of different studies that we see as exemplars, whether it's the factors that are affecting each stage of that health research knowledge translation process, whether it's experimental studies to test the effectiveness of different dissemination strategies, particularly those that might differentially impact underserved communities or other subpopulations, and even broader studies on how target audiences are defined and how evidence may be packaged for different target audiences. On the implementation front, again, we have a couple of exemplars, although this is by no means exhaustive, where we're looking at a whole range of different interventions across the care continuum: prevention, early detection, diagnostics, treatments, clinical procedures, and thinking about how well they can integrate into a whole range of care systems and measure the extent to which they're used and ultimately sustained over time. We have an interest in issues around fidelity of implementation efforts, or how does one know that you're delivering an intervention with substantial quality, and how can you identify what those components of quality are. And then again, we're thinking about this in the longer-term view, so not just looking at initial implementation, but what happens over time, and how can we best enhance the sustainability of different improvements within practice. On the D&I research topic front, we do see some overarching questions, overarching areas that we could see benefit from advancing. So understanding about the capacity of different care delivery settings to conduct and actually succeed in implementing effective interventions or disseminating effective knowledge. We certainly continue to see a need for development and even more important, the testing of theoretical models for dissemination and implementation processes. And we're at a point in the field where there's a lot of capacity needed in terms of appropriate outcomes measures and advances in methodology. So if this is something that you're interested in, really building the research capacity, there are studies that fit with that as well. So just to orient you for anyone who has looked at previous versions of the program announcement, similar to the last set of announcements, we do have a focus on both dissemination and implementation. We have a focus on developing generalizable knowledge, so how does this knowledge help us all in thinking about better ways to disseminate or implement. We do similarly retain an interest in transparent reporting on feasibility issues, so we want to know how are people being recruited, how are the different interventions being implemented. The more noise in this kind of science is actually of interest to us. We really are interested in mapping the complexity of trying to change practice and trying to improve population health. We retain an interest in health disparities and efforts to remediate them, and in research in low resource settings, and retain an interest in understanding the cost and the needed resources in order to make successful implementation take hold. We do have a couple of things that we'd like to call your attention to, because whether they've been in previous versions of the announcement, we've been trying to promote them particularly in this one. One is an explicit focus on advancing measures for dissemination and implementation. We've had efforts to try and pull together available measures, and there are gaps in what's available. And so we would love to see if people have a particular construct that they're interested in better measuring, that's fair game here, and particularly when we're thinking about constructs in the global environment. We would like to stress our increased interest in sustainability, as well as the reason why we're here, an increased interest in applications that span the globe. We also wanted to add within this announcement the emphasis on what we called scaffolding of interventions, as well as thinking about complex patients. Here we're talking about not necessarily focusing on an individual practice that you're trying to implement, but how to create better systems of care that involve a whole range of evidence-based solutions. Also not as interested only in focusing on a single need of patients, but thinking about complex patients, which are often people who are struggling with or dealing with multiple health issues at once, and how do we improve care for them. We'd like to stress our interest in innovative designs that are appropriate to dissemination and implementation, stressing the opportunity to make them more relevant to the different settings where the research is taking place, make them more rapid, and make us be able to learn more from the results of any individual study. And we do see more of an interest worldwide, really, in understanding the impact of health policy and in using not just more traditional prospective research methodology, but thinking about simulation modeling. Just so you have a sense more of the sort of word soup, we do have 15 different institutes and centers that are involved in the announcement. You can certainly take the time to either ask us or follow up on what does each abbreviation mean, but it basically represents a pretty broad areas of health, areas of populations, as we said before, and areas of interest. There are the RO1s, which are the largest research project grants. There are small grants that are the RO3s, which are up to $50,000 in direct costs per year. And then there's somewhere in between, the R21s, which are exploratory and developmental, and basically aimed at where you may have some early work that you're trying to do in a sort of more pilot way, building toward a larger study. You'll notice that the RO3 and the R21 do have a sign-on from the Fogarty International Center, which has done a wonderful job over the years in promoting and improving global health research. Just to underscore a couple more things within the program announcement, we do see an expansion in terms of the health topics that are covered under this announcement versus previous ones. An expansion in our thinking about what contexts would serve as good locations for implementation efforts, and also more focused on sustainability and the evolution of practices over time, rather than assuming that a practice is tested and then frozen. On the method side, we're certainly interested in taking advantage of methodology around comparative effectiveness research, comparing different alternatives toward improving a particular outcome. As we said before, we're interested in simulation modeling and actually the development of new and better methods. We're also interested in thinking about how each individual study can build lessons, and that those lessons can really come together across different studies. So where you're interested in a particular question, we'd like you to think about how is this advancing the field on the basis of what has been known before. And we also retain our interest, whether it's within our training institute that we run each year, which is open to people from all over the world, or it's through some of the grants, where sometimes a particular study may be a nice opportunity to train new investigators. We wanted to just lay out a couple of considerations that we think about in terms of foreign applications, just to let you know, and this is something that I think Josh may be able to clarify anything that I'm missing from his vantage point at Fogarty. But just some general considerations. The National Institutes of Health can make grant awards directly to foreign institutions. So there isn't a problem as long as it specifically lays it out within the announcement of having direct award go to the institutions that you may be working at. It is important to check the eligibility criteria on the funding opportunity announcement. For this particular set of PAs, international applicant program announcements, international applicants are eligible. We also do think that and hope that you see the special opportunities that international or foreign applications can provide for furthering research, whether it's being able to capitalize on unusual talent that might not be in existence or in abundance within some of the domestic institutions, or really from capitalizing on the chance to learn from unique resources, unique populations, or unique conditions that can help to advance our knowledge about health in general. It's also the case that foreign applications may be seen as augmenting what's currently going on within U.S.-located research. At NIH, there are some limitations. There are some programs, there are some grant programs, for example, small business-related research programs that are limited to U.S. citizens. So if you're interested more broadly in applying to NIH, it's just important that you're understanding what some of the opportunities are, but also some of the limitations. We don't want you to go too far along a given path only to find out that it's not as eligible for your particular circumstances. Note that we do recognize the potential and the importance for foreign applications benefiting the health of the American population as well as your local population. So usually working with program staff to identify how might this not only be relevant to your local circumstances, but be more broadly relevant to populations within the U.S. There's been a long history of successfully explaining this, and so our program staff across the different institutes should be well-versed in helping you if you have any questions about that. We also do see the opportunity that many take advantage of partnering with a United States-based principal investigator on the application. It can be recommended. It's certainly not required. But given that we're at a state where all NIH applications can now use a multiple PI designation, meaning that you can share leadership among different investigators, we see that it can be an advantage, particularly if you haven't had experience with NIH funding before. So when you can partner with researchers who have previous funding experience working with NIH, that can be an asset because they may be better able to answer questions and really to solve some of the problems that you might have a difficult time anticipating just in terms of the conduct of the research. Some applicants will choose to have the domestic or the U.S.-based institution as the primary and think about foreign partnership through subcontracts. Others may do the reverse, where you may have the primary grant would go to the foreign institution, and there might be subcontracts for U.S.-based institutions. We do want to mention that all projects that have non-U.S. research activities do need to have an additional clearance process, which basically goes through, more or less the U.S. Department of State, but also in many countries there may be local procedures within your countries through the local government in order to ensure that you have the clearance to be able to conduct the research. So it's, again, really important that you not only reach out to local resources that you may have in terms of understanding research within your country, but also to program staff over here who can help with navigating through the U.S. system. So just a couple of things to remember. It's not an instant process, and in fact it may take a number of months to even walk through the process of preparing for applying. So it's important to start early. There are windows through which you can submit your application that usually are up to a month before the due date of the application. But just in terms of making sure that you have all of the steps in place in order to apply, it's very important to start early and to reach out early to your program officers. Because most of our applications at this point are submitted electronically, there are several different processes that you need to go through to ensure that your institution is able to do that. And so there's a registration process both for you and your institution that needs to take place prior to submission. And it may take a number of weeks to make that happen. So again, start early. If you're thinking about an application of a particular size, for example, one that exceeds $500,000 in terms of the direct cost of the application, you do need prior approval from NIH and specifically from the institute at NIH that you're targeting your research. So it's important to ensure that you're connecting again with your program staff as early as possible. Just a quick point, not to skimp on methods. Sometimes it may be hard to figure out how do I fit all of the information within a given application. It's important that you make sure that it's clear to reviewers exactly how you're trying to conduct research, where you can use shorthand to talk about how this follows established procedures for conducting different analyses. That's great, but don't assume that the reviewers will know what you're going to do. It really is important that you lay it out as much as possible as part of the approach of the application, what methods you're using. You do want to demonstrate your partnership, particularly in this announcement, where it's important to understand how are researchers working together with local stakeholders, as well as your understanding of the context in which implementation efforts are going to be set. We have it in red. We can't underscore it too much because that we do see it important to talk with your program officers. There's a set of institute contacts. Not all are available on the call today, but all are available to answer questions following. So if you look on the program announcements, you can see for each participating institute that there's a specific person who has made themselves available to answer any questions. If you do have any difficulty contacting a particular institute or you're not as sure on the international front, you can always contact me. You can always contact my collaborator at the National Cancer Institute, Russ Glasgow. You can also, I would assume, particularly around international issues, contact Josh Rosenthal, who is a contact on the R03 and the R21. We're here to help, so the more that we can answer your questions, the better. There are, just to close off, there are a number of resources available if you want additional orientation, and as I said, you can always contact us, but there are a few more general resources available around NIH grants. There are specific websites that help to orient you toward what's been done in terms of implementation. So the National Cancer Institute maintains an implementation science website where they list here are the studies that have already been funded and their topics. It lists key references and publications that might help you orient, and it does link to these announcements that we're talking about. There also are other sources available to help navigate you through the whole electronic submission process, which has been around for a number of years. It's far smoother than it was when it first started, but the resources have been refined over time to really help you. So before we open it up for questions, just wanted to turn it over to Josh for any either clarifications or additional points that you'd like to make.
Thanks, David. My name is Josh Rosenthal. I'm the Division Director of our Extramural Research and Training Division here at Fogarty. And we're very excited to continue to participate in this valuable initiative. It's been an area of keen interest here at Fogarty. For those of you who aren't familiar with the Fogarty International Center, our focus is on global health, research and training with a particular focus in low and middle income countries. And implementation science is something that we have paid particular attention to in the last couple of years, especially around the HIV scale-up and delivery of both treatment and prevention kinds of services. We're also increasingly interested in the relevance of dissemination and implementation science in low-resource settings in the developing world and how those may inform practices here in the States. So those are just some general things about Fogarty. Let me emphasize a couple of points that David made regarding more generally applicants for either directly from international applications, institutions, or for work in international settings. While there are a number of successful direct applications from the developing world or from other parts of the world, most often people are successful when they are applying with U.S. investigators that have a history and a knowledge of the NIH funding process. It's both the mechanics and the culture, the grantsmanship involved in getting a grant through successfully or take a fair amount of experience. So if you're from another country and planning to apply and you have not thought about involving a U.S. investigator, you might give it more thought and either apply with them or directly partnering with you or vice versa. When you do that, be clear about the roles of both the local and the U.S. investigators, what each of the partners are going to do in the research endeavor, and make that clear in your application so the peer review committee can and the program officers can evaluate that clearly. The other thing that I think can't be stressed enough, and that will come naturally from the orientation of this effort to stakeholder involvement and the like, but seek and document your local institutional support at the universities, ministries of health, NGOs, other organizations that you plan to collaborate with, and then make sure that's clear in your application as well. That will not only help its probability of getting funded, but will also help you downstream to get the research off the ground in a timely manner and help you address any unforeseen challenges. Unforeseen challenges are common in the developing world. The political changes, budgetary changes, currency fluctuations, changes of staffing. So expect the unexpected and make sure that your community is behind you. The other thing I want to emphasize is something that David said: apply early. If you're applying from a foreign institution, especially one that has not in the last year or two had an NIH grant, while the electronic submission process has been around for a few years and is working more smoothly now, there are new barriers. There are new wrinkles in the system just about every year, and we've had a number of very good applications not make it to the peer review simply because they did not check in with all the appropriate registrations and stay in touch as their application was making its way through grants.gov and the ERA Commons, et cetera. So I would recommend you start 2 weeks early if you can, and I would start with the registrations even before that, but even start submitting the application a couple weeks early and then stay on top of it. Follow it through the various registrations and processes. And at the websites that are indicated in that email, especially the electronic submissions, there's a webinar there, and there are other links for help desks and others. But it's more complicated than it ought to be. It's getting better, but it's still a bit of a trick. And I think the last thing is a general point and something that embodies the spirit of the Fogarty Center, and that is your research is intended to generate general knowledge with both local implications for the improvement of health and ideally for a more global setting. But make sure that you leave knowledge and expertise behind, that you can train some of the people involved so that beyond these fine publications and potential interventions that are developed, there are people there that embody the skills that you have developed and employed throughout the application process. I'll stop there, David.
Thanks very much, Josh.
Great, thank you. So now we want to open it up for questions. And again, just to remind everyone, there's 2 ways to submit your questions, and I know we already have a few in the queue. You can press *1 to ask your question live on the phone, or you can type your question in the Q&A tab. And just be sure to hit ask, not the little hand. And just as a reminder, if you have additional questions, you can email us after at ncigcpsteam@mail.nih.gov. I know that's a long one. And you can also request a copy of the slides from us then. So with that, we'll go ahead and get right to some of the questions that came in during the presentation. From Cheryl, she asked, can an investigator be on more than one research grant? So, for example, a dissemination grant and on an intervention grant. David?
Yeah, so the answer to that is absolutely. In fact, many of our investigators do have, over time, multiple grants that they're on. The major thing is that with each grant, you're specifying a particular amount of effort on it. And at this point, it's done in terms of months of the year of full-time work on a grant. So obviously, there are questions raised if it looks like your total effort is exceeding 12 months of the year. But short of that, absolutely, you can think about multiple grants. It's often a good experience to think about the learning across a set of different grants.
Great. A second question from Raphael is, the examples that are listed on the NCI website for the 34 grants that have been funded through NCI, none of them are international or non-U.S. institutions. And so I guess the question is this process likely to be different in this call, and what are the real chances of applications coming from outside of the U.S. being funded? And just to clarify, the NCI website that we've listed there does not list all of the grants that have been funded. So
Actually, on the NCI website, there is a link to the Office of Behavioral and Social Sciences Research website, which does have all of the NIH-funded grants on it.
Yeah, but it is a broader. I think it's a very good question, because I think one of the things that we have seen in recent years is not that we're seeing zero applications coming from outside the U.S., but we're not seeing as many as might be advantageous. So the reason why we're having this webinar is to promote that this opportunity is open to folks around the world, and if over time we can see more opportunities to take advantage of non-U.S. studies, then that would be terrific. So it is a relatively smaller amount, even as Cindy Vincent had said, if you go to the OBSSR website, which lists broader. But again, the reason why we're here today is to suggest that maybe not everyone has heard about this opportunity, and thus we might see more over time.
Great, good clarification. From John, the question is, prior approval is required for $500,000 per year or $500,000 overall?
Right, it's a good question. The answer is per year. So if the direct costs of your application across all of the years sums to $500,000, that does not require prior approval. However, if in any one year you're wanting to use more than $500,000 of research funds in direct costs, then you do need to get prior approval. Just note that the procedures may differ across the individual institutes to which the application would be assigned. So again, it's helpful to talk to your program staff. It's also usually the requirement that it's at least 6 weeks before the submission date. So if you're thinking about a larger study, you really do want to contact folks as soon as possible. And just to make a more general comment about submission, these announcements do go along with the regular submission deadlines for NIH, which means that new grants can come in February, in June, and in October. So it's not that you have to try and, it's going to be a one-shot, and if you miss that, you're not going to be able to get through. It would roll over to the next opportunity. But think about your timeline in terms of when you think you'll be submitting in one of those 3 months, and then allow enough time in advance to get everything done.
Great. We have a couple more questions online, but I did want to check in with our operator and see if there's any questions on the phone.
I'm showing no questions on the phone line. I would like to remind participants, if you would like to ask a question on the phone line, please press *1.
Right, thank you. So then we'll return to the questions on the web, and one from Borsika about whether or not there are any recommendations for a multi-country grant proposal that would involve multiple European countries, as this might raise some additional issues in terms of logistics. And is there any examples of such a proposal that's been funded?
Thank you, Borsika. It's a good question. If I understand it correctly, it's just trying to think about are there sort of successful previous studies that one could draw on. I think the most important thing, as always, is to, depending on the area of research, there may be some different suggestions and different successes across different institutes. So I think the first thing that you would want to do, certainly, is to contact the program officer who would be more specifically within that area. Within the announcements, to my knowledge, we haven't seen a specific grant application that cut across different countries, particularly those in Europe. But certainly there's experience at different institutes with clinical trials or other research that's involved consortium among multiple countries. So I think the shortest answer is, depending on the area, you might be able to benefit from a number of different experiences, but it's going to be important to make sure that you're in touch with the particular program contact.
Great. From Jessica, there's a question about the 3 cycle due dates that you mentioned, and just to clarify, does that mean that for each grant there are 3 opportunities to submit an application?
So there are 2, thank you very much for the question. There's actually 2 different pieces to this. So one of which is the available deadlines for anybody to submit an application. That's what I was talking about in terms of the 3 due dates. So that means if you're thinking about an application that you want to submit to NIH, there are standard 3 different months of the year in which you can make that submission, and that would be February, or you could submit that same application in June, or you could submit that same application in October, and that's for a new one. There are actually 2 opportunities over the years to submit any individual study idea. So if you submit an application in one of those deadlines, and it doesn't matter which one, it will get a review, and then you'll get the comments back. The comments may either suggest that the application or the study is ready to go, and it would move on toward ultimately, optimistically, there being an award. So you could just start working on the actual study. If it happens that for whatever reasons there are weaknesses that the reviewers pointed out, or it doesn't yet have the strength to make it through what can be tight funding lines, you can resubmit any application a second time. It used to be the case that NIH applications could come in a total of 3 times, but a couple of years ago there was a decision to reduce it to 2. So you can submit any study idea once under the original submission, and then if it doesn't get through on that first time around, you can submit it one other time. After that, there's actually a lot of efforts trying to ensure that any one study only has those two submission opportunities. And so what it means is at the end of those 2, you really do need to think about a new study. It may be related, but it has to be substantially different in order to qualify as a new application.
David, can I just add?
Yeah, Josh.
Just to clarify, when David refers to resubmitting the application, the assumption is that the application has been revised and amended to incorporate any comments from the peer review that you received in the last round. And so a resubmission should really pay careful attention to what the comments were in the last round and amend the application accordingly. In fact, the peer review will look at that. They'll look at the previous critique and see whether or not the application has in fact addressed the previous concerns. So it's referred to as an amended application, then you get one shot to amend it, is what David was saying.
Okay, thank you for the clarification there, Josh. Another question that came in, this one from Barb, and whether or not program officers are open to reviewing an abstract or concept for relevance to the funding competition. And a second part to that is whether program officers are situated within each institute only, or whether or not there are some general program officers for D&I more generally.
Right. Okay. Thanks, Barb, for that. So absolutely, program officers are open and, in fact, would prefer to have the chance to talk and discuss an abstract or a concept for relevance prior. We certainly want to provide as much assistance as we can to help you, and often it means that you have additional chances before the review to get feedback from folks who have a lot of experience in guiding different applicants. So we would love to see, usually it's great when you're contacting a program officer to be able to have, even if it's a one-page abstract or just the set of specific aims that you're thinking about, send that as your first contact to the program officer so then they can become familiar with what you're thinking about rather than wasting valuable time on you trying to orient them for the first time. So that's absolutely encouraged. We would love to see that. The second part of the question are about program officers and where they're situated. So there are generally program officers being within a particular institute. So what you'll find is a contact from each institute or center on each of the announcements. That's what we referred to before. In terms of more general program officers thinking about dissemination and implementation, that we have had involvement and support from our Office of Behavioral and Social Science Research, and so there have been contacts who are able to look across different institutes. But basically you can always feel free, Russ and I and even others, but Russ and I certainly listed on the slides as being available for any more general dissemination and implementation research questions. So because a number of us have been coordinating efforts and really collaborating across different institutes, I think we'd be happy to help steer you if you have more general questions. That doesn't mean that you shouldn't be thinking about the specific contact, but because we all work pretty collaboratively together, you could include us or not. If it's helpful, you can definitely ask us as more general, but don't pass out on pass the opportunity of connecting with the specific institute contact.
Great, thank you. I know we have a couple more questions on the web, but I did want to check in with Brandon to see whether or not there was any questions on the phone.
Yes, we have a question from Cameron Willis. Your line is open.
Thank you. I just had a question about the degree to which applications might be encouraged from new investigators or early career researchers.
Thanks. That's a great question. I think NIH has been, certainly in recent years, particularly wanting to make sure that there's the pipeline of investigators across all stages of the career, and as such has been quite interested in fostering early stage or newer investigators, and that's definitely the case here. It is the case that for some people who are newer to the field, that we look to some of the smaller grant mechanisms as an opportunity to start, just because, frankly, managing a large research study when you haven't had that experience is quite a challenge. And so some people do choose to start out with the small grant, with the R03, or with the developmental or exploratory grant, the R21, but we'd absolutely love to see newer investigators enter the field. It's a field that needs more people, so I think it's absolutely underscored here. Thanks for the question. It's also the case that if people are interested and aren't as sure about their expertise in the field, that we do, as mentioned before, run an annual training institute for dissemination, implementation, research, and health, which is called TIDER. There is a link, I believe, on the slides. If for some reason you don't have it, you can always type into your favorite search engine, TIDIRH, and you'll get there. I don't think anyone else has used that acronym.
Great. Any other questions on the phone?
Showing no further questions on the phone line.
Great. Okay. Then we have one from Susan on the web, and that was whether or not we're targeting applications from developing countries more than from developed countries.
It's a great question, and I think Josh may also want to weigh in here. We have not specified that it is specifically for developing countries or for developed countries. We think that there's a lot to learn. That said, there is a priority within the announcements around trying to understand better implementation within low resource settings. So that kind of work does potentially leave opportunities, particularly within low and middle income countries. But as far as the announcement goes, it's really open to both. And again, you might want to think about within your specific area, what are the opportunities, whether you're within a more developed country or a low and middle income country. Josh, do you want to add anything?
Only that will vary a bit across the NIH, I think, in how those priorities are reflected in their own internal systems. From the Fogarty Center, our participation is exclusively focused on low and middle income countries as per our overall funding policies. But as you say, across the NIH, there is a substantial number of projects that are led by investigators from Australia, the UK, Canada, Japan, et cetera, and for research there or in the U.S. Perhaps I would just suggest that you pay special attention in those cases to the criteria that David pointed out earlier in the slides about making it clear what the particular value of doing that research is by a European investigator or in a European setting. it's clear in the for cases in the developing world, but less so perhaps. Just a little bit higher thresholds you might have to meet with peer review. Is that fair, David?
Yeah, and I think, again, it's great within the particular situation because there can be some variation across institutes and centers to connect with your program officer, early on that, because I think they can give you a nice read within the given research topic.
Great. So there's two questions that are around sort of success rate. The first is success rate for the international groups that are funded, and then the second one came in that's a little more broadly, just generally what's the success rate for D&I applications. So I'll start with you, David, on that.
Sure. So I will say that, and it was referenced in an earlier question about looking on the specific NCI website and not necessarily seeing the international applications, that to this point we have had very few applications submitted from investigators studying populations outside of the U.S. So with a small sample size, there isn't as much to draw from, hence the reason why we're on today. On the OBSSR website, you'll see a few more applications. We haven't, to this point, I think, calculated the success rate for those global applications. But I think, we have seen a few of the smaller grants funded, and we're encouraged by your attendance here that there will be more forthcoming. But right now I think it's too small numbers to be able to give an accurate success rate versus the overarching pool. The second question being about the more general acceptance, the success rate. What is important to recognize actually at this point, and this may transition into another question, is that all of the responses to the program announcement do come to a standing review committee that only focuses really on dissemination and implementation research. And so they have their own base for percentiling, which does give the opportunity to ensure that an equivalent number of studies that come through this announcement do get funded to those of the success rates across all of NIH. That had been a concern because there are certain complexities in conducting this research that may make it seem like it might be harder. So by having a standing committee, it means that the committee percentiles reviews against the other applications, and so it means that it will have just as natural a shot, an opportunity to get funded. Now, in terms of the specific success rates, right now they're differing so much across the individual institutes that certain institutes, given funding constraints, are at a tighter funding band, and others are able to go further. In the past, the rough success rates of applications have been in the 20s, 25%, and that's estimated, but it's going to differ by institute, it's going to differ by types of applications. But just to give you a frame, that's roughly what we think about in terms of success rates.
Great. A question from John about the review committee that you mentioned and the D&I specific review committee, and how many individuals are familiar, or are individuals familiar with the context of international health issues?
Yeah, I think it's a good question, and I think one thing that's helpful to think about with the Standing Review Committee and just how review committees are developed or staffed in general is that there's a set of standing members, and then there's the opportunity with any given round for the person who heads the review, the scientific review officer, to bring on additional expertise as needed. During the early years, when there hasn't been as much of a set of international applications coming in, there hasn't been as clear a need to have the standing members. So there have been, while there are standing members who have international expertise, it hasn't necessarily been that they would choose the person whose primary identification is as an international dissemination implementation researcher. However, I think as more applications will come in, the membership of the committee is going to vary according to what they see. So in the short term, we work very closely with the scientific review officer, and she does bring on individual members to ensure that she has the adequate expertise, and has done that each time that we've seen an international application come on. If there is an influx of applications, I'm sure that they will adjust the standing membership to reflect that.
Great. A question from JD about whether or not we can provide any additional examples or criteria of how NIH is assessing the benefit of these international projects to the U.S. So, for example, if a study is looking specifically at D&I of cardiovascular disease care in low- and middle-income countries, but not in the U.S., is that still appropriate?
Yeah, it's a great question. I think there's a couple of different ways that we think about the generalizability of the U.S. populations that might be useful. And again, any individual example would probably benefit from a specific talk with the program officer. One way is thinking about, does it generalize to populations within the U.S.? So if you're targeting a particular subpopulation within a country, or that population has an associated similar population within the U.S., that can be one. If there's a particular subpopulation within the U.S. where you say, well, in this country, it's an enriched opportunity to learn about that population. That's one. With dissemination and implementation, it can often be related to similarities in terms of the setting. So it is one where you might be able to learn from low-resource settings in a particular country that generalizes nicely to low-resource settings within the U.S. Or as a third one, there might be similar ways in which care is organized that gives you a chance to learn about how does one improve that care within a U.S. context where there's a similar structure of care. So I think whether it's the population or it's the sort of broad context in which care is delivered, or the specific system in which care is organized. Those are three opportunities that one can think about, and I'm sure that you can come up with others.
Great. Before we get to the last two questions that I see on the web, I just wanted to check again if there's any questions on the phone.
I'm showing no questions on the phone line.
Great. Then there's a question from Barb again, saying that the presentation tended to focus on healthcare systems and individual patients. Is the review panel also open to and familiar with population and public health D&I research?
Yes, it's a great question. The answer is absolutely. That is the case. Sometimes in shorthand we tend to emphasize certain things but not everything. What you'll see if you read through the announcement is certainly reference to and the importance of both population health and specifically public health efforts. So we were very broad in terms of thinking about what is it that we'd be interested in learning about the implementation of. So that includes policy-level interventions. It includes interventions targeting public health, just as we may see more focus on clinical or community settings. So all of which are important for us in the announcement.
And the last question is, we come up on the hours from Raphael, and whether or not, what are the chances of being successfully accepted to participate in TIDER for international applicants? And is it a big bonus for an international application to succeed?
So in terms of the TIDER, it shifted each of the years. The applications the first year were huge. I think it's been, I'm going to estimate that it's sort of been around a quarter, is that about right, of the applications that have been submitted. I think there's enough spots for about a quarter of the people who are interested. It may differ year to year, though, because as some have successfully taken part in the training, obviously they would leave the applicant pool because you wouldn't specifically do it twice. I think within the application, though, there are specific opportunities to talk about why you might be particularly well positioned to gain from the Institute as well as to provide certain things. So there sort of have been bonuses that one can think about in terms of being able to talk about the ability to advance D&I research in settings that maybe haven't had as much experience there. So we would very much encourage you to apply. We would love to see sort of the increased global element. We do have people from WHO who have been part of the TIDER training from the beginning, and so we would love to see more work and more people interested on the global side.
Great, and we'll just end with one last question that's specific to the PAR from Paula about whether D&I research for psychosocial interventions with populations at risk is relevant to this program announcement.
Yes, so the answer to that is absolutely. Certainly the National Institute of Mental Health has a long history of focusing on psychosocial interventions, as do a number of the other institutes, whether it's the National Institute on Drug Abuse or Alcoholism and Alcohol Abuse, Cancer Institute, et cetera. There's a lot of scope for different kinds of interventions, and psychosocial are absolutely in there.
Great. Well, we'd like to thank you all again for joining us from around the globe at all different times of day for you all, and just encourage you all that if you do have any other questions, to please contact the program officers in that program announcement. We'll also be sending around a link to an evaluation survey, which will include these slides for the presentation. So thank you so much for your participation, and have a good day.
This now concludes today's conference. You may disconnect at this time.